My surgery was scheduled for March of 2020. And if you remember what happened in March of 2020,
I do.
the quarantine,
Yeah, everything shut down. Yeah.
including my surgery. That is literally when my wife stepped in. So, me being the typical male, I whined and moaned and cried about how much my elbow hurt every day at home. So she finally started force feeding 2 supplements down my throat. 6 weeks later, pain free.
Welcome to Ultralife Today. My name is Adam Payne, CEO, founder, and inventor of the Protosorb technology, makers of UltraCur, the curcumin you can feel. We're here live in our studios here at Ultra Botanica in Oklahoma City, continuing our interview series with functional doctors and naturopaths that are breaking ground and in the business of changing people's lives. I think everybody's going to get a real benefit out of meeting today Dr. Douglas Rowles. Hey, Doc. Welcome to Ultralife Today. How are things going?
It's going great. Thank you very much for having me.
Well, I think your breed of medicine is the only breed of medicine that we should have in the country for the primary physician, right? Because it's a different paradigm. Maybe you could introduce yourself to our folks here on Ultralife Today by giving us a little bit of your background and how you got here. What journey brought you to this place here, Doc?
Well, grew up in Rhode Island, New Englander, went to college in Rhode Island, Providence College, kind of decided on not just medicine, but I kind of knew that I wanted to treat athletes at a young age. So it's kind of,
Is that because you were an athlete yourself, or?
I tried to be. I mean, I was decent, played all the sports, but I never, knew I didn't have a future in it.
Sure.
But, just from being a fan and just going to all sports events and everything. But, I kind of went to college and subsequently medical school knowing I wanted to do orthopedics,
Oh, interesting.
which was kind of a mixed blessing because it made everything else kind of boring to me. Uh, I ended up when I was applying to medical schools, money was short at that point. So I came across a school that didn't have an application fee, and honestly, at that point, I was so strapped that I didn't even look and see what the name was. I'm like,
Oh
oh,
no.
well, let me put this on there. And sure enough, I got an interview. When I showed up, the first thing I noticed is, wow, they have unbelievable parking for free. This is incredible. Because at the time I was in Washington, D.C., parking, forget about it, And push came to shove, and I ended up going to the military medical school called Uniformed Service University in Bethesda, Maryland, right across
Wow.
from NIH, actually. And then from there, 24-year career in the Navy with lots of, bizarre type of experiences that most physicians aren't going to get.
Sure. The Navy is kind of, you guys see the fringes of the universe that almost that none of the other armed services see, essentially, because you're on a mobile platform, right? Were you out to sea at all, or were you mainly at bases?
Well, it's funny. When I was going through, after I did my internship at a naval hospital in Virginia, and at that time, it's changed now, but at that time, they didn't let you go into residency right away. They
Oh,
gave you
interesting.
2 years as what's called a general medical officer. So I was on a ship. I was on the USS Carolina, South Carolina for 2 years,
Wow.
the last nuclear guided missile cruiser in the Navy. In fact, I was there when it decommissioned too.
Wow.
And then right from there to residency at the same place in Virginia.
So that boat could essentially travel around the world without needing to refuel. What a thought.
Yeah, well, a couple things I didn't realize. When you're attached to a nuclear ship, that means you can't be at at the pier with the nuclear reactor on.
Oh,
So Monday through Friday, we would be about 3 to 5 miles off of the shore, which was, by the way, just out of stem cell range, and that did not count as underway time. So Monday through Friday, I was living on the ship, go home on the weekends, and then rinse and repeat. That didn't count the several deployments we had. So it was a long time on that ship.
wow. That's I'm sure you had if you close your eyes, you could probably memorize the layout of all the different places that you would serve and rest at. It's probably not too many.
Well, Navy ships are basically floating factories, and I wasn't prepared for the fact that I was expected to be the dentist.
Oh no. Really?
Well, because once, this was an old-fashioned ship type. When you look at the Navy vessels nowadays, they have more of a blocky kind of shape to them, which makes them, better in the rough seas. The South Carolina was one of the last that had that bulleted kind of sharp point edge, right? Meaning we were taking between 30 to 45-degree pitch and rolls, all the time.
Oh my gosh.
So at least once a day, one of the fellows on the ship would headbutt a pipe, you know, and show up to sick bay with a broken tooth, and I'm like, well, okay, I don't know what to do. Like this, Yeah,
Well, I can diagnose you. You have a broken tooth.
yeah.
Congratulations.
I recommend soup and yogurt. Correct.
Wow. It's there's so many life experiences that kind of drive us into different directions. Do you know that was there an aha moment when you were serving in the military that set the stage for what your life was going to be like after retirement?
Not during the military. No. The
Okay.
aha moment came when I got out. Yeah.
So what was that moment? What happened? Maybe you can describe it for us, because
Oh, for sure.
what I find, Doc, is each of us, especially when we're in the business, if we're truly in the business of wellness and healing, there's a spark or an impetus that carries us through the raging difficulties that you have to navigate through in order to get and to actually just be in practice, right? I mean, it's quite a gauntlet.
Oh,
I mean, you had that for orthopedics, right? You wanted to do that, but moving into functional medicine and naturopathy it's quite a transition. What was that moment? I mean, did you just wake up one day and say, you know what? I'm gonna learn all the things I can learn about herbal medications and their ability to help wellness. I'm sure it has to be something different.
Oh yeah, I actually had two. One introduced me to it, and the other just put me over the edge. But
Okay.
the introductory, and I should preface that by kind of giving my wife credit. Uh,
Oh.
she's been with me ever since I was in medical school, and she's always been chirping at me how much she didn't trust pharmaceuticals. She's always been that way. I
Didn't that rub you a little bit wrong, being that you were in the business of prescribing pharmaceuticals?
That's just it. My specialty, in fact, my subspecialty within orthopedics was sports, and
Ah.
means I scope people. I like to say I just play video games for a living. And within orthopedics, we don't really treat systemic disease. So the only medicine
Right.
I ever dealt with were antibiotics and pain relievers for the most part. So I was kind of sheltered, and that's probably what kind of that kept me going. I didn't really have a reason to think one way or another about chronic disease or anything systemic. I was kind of stuck in my little area, and I just, much like most of the doctors are. I mean, when you have a specialty, you live
You're kind of you're stuck.
yeah, you live in a
Yeah.
box, and you just think about what you have to deal with. So I was kind of sheltered, but the wake up moment for me came right around, well, I retired from the Navy in 2015. When you retire from the service nowadays, you have to basically get anything that's ever been wrong with you, you have to get worked up, like an MRI of everything.
Wow.
You need to document for the rest of your life in case the military has to pick up the dime to fix what the problem is. So at the time, I had chronic tennis elbow in my left elbow.
Hmm.
Now that being a condition that I treated, I ordered myself an MRI, and I looked at my own MRI, and sure enough, I saw the chronic tennis elbow. But what I also noticed, this was in 2014, a year before I retired. What I noticed, wasn't expecting, was my left common biceps tendon, which connects to the radius bone below the elbow, looked like a small grenade went off in it. And
Oh
at
wow.
that point, I had no
So
pain.
what had happened? Do you know? Do you have
Uh,
any theories?
well, no injuries. I think it was just chronic wear and tear. When I was
Ah.
young, back in the day, I used to lift heavy weights and played all the sports and all that. So I certainly had some mileage on me. But at that point, no pain, no symptoms, no weakness, nothing. And that continued on. I tried just to forget about it, out of sight, out of mind. Uh, I got,
Forget about it. You're
well, I
you're
got told,
you're the tendon connecting your arm to the muscle.
that's right.
Forget about it.
Well, you don't go looking for trouble if it's not active yet, right? But
But I mean, what did it even occur to you that maybe could have been a degenerative process that could progress, or
yeah, no. But at that point, I hadn't, I haven't been lifting weights. I'm like,
right,
I'm
right,
not, I kind of figured, well, I'll worry about it if it becomes worse or if it
okay,
becomes symptomatic. But that finally happened 4 years after I got to Oklahoma. By 2019, I was
hmm.
literally wearing an elbow brace. We trained residents at Oklahoma University, so I would have to have whichever resident was with me actually lift up people's legs and put it on the OR table for me during surgeries. I mean, I'm left-handed,
Wow.
so it was a big problem. I was actually scheduled to fly back to my last duty station in the Navy, Hawaii. I know it's tough
Oh.
because I had a prior partner that fixes these tendons in a unique way,
Oh, really?
and I wanted.
Oh, good. Pray tell. What is he? What have they been doing? I mean,
Well,
because that's a significant problem. Losing that attachment can be
well, it's
quite painful and
uh,
quite difficult to repair.
well, I say unique. Maybe that's not the right word. He had a different approach to the surgery, right?
Okay.
So, and most of the time, and all the ones I've ever done, you're making the incision in the antecubital fossa, which is right in here, and
Yeah.
to be a long incision. He fixes them through a small incision on the other side of the bone, right here, and he can
Oh,
work
interesting.
work around the ulna and get to the radius just by rotating the wrist.
Oh, interesting.
Now that doesn't work for displaced tendons, but it works for high grade partial tears, which is what I had.
So,
So yeah,
okay.
so,
So you still had some attachment, and what you needed is to reinforce what you still had there.
correct. I mean, the typical thing for a chronically torn partial tear, torn tendon is you have to scrape out the diseased part of the tendon, the one with the chronic
Right.
inflammation, the scar tissue, freshen it up, so to speak, and then repair it solidly back to bone. Put me in the oven and let it cook. Uh, So, long story short, I was all set. I had 6 weeks of practice blocked off. I had plane tickets. I mean, I was ready. My surgery was scheduled for March of 2020. And if you remember what happened in March of 2020,
I do.
the quarantine,
Yeah, everything shut down. Yeah.
including my surgery. That is literally when my wife stepped in. So, me being the typical male, I whined and moaned and cried about how much my elbow hurt every day at home. So she finally started force feeding 2 supplements down my throat. 6 weeks later, pain free.
What?
And I'm
Okay.
free. In fact, just as a test, I even started lifting weights a little bit. No problem at all. So that literally
And
shocked me to the core because
did you? I'm curious, Doc. Did you re-image the area to see what had
I
changed?
have not. No,
You have not. Okay.
nope, not interested. Not interested.
Okay. Not interested.
I mean, academically, I am, but
Right.
personally, I don't want to know. You know,
Okay.
but
But you felt 100% better or
absolutely,
1,000% better.
yeah, yeah. And when I tell you that shocked me, that's an understatement because I have probably repaired at least over 100 biceps tendons in my career. I thought I knew that very well. According
Yeah.
to my education and my experience, it's a problem that is only treated with surgery because we need blood supply for things to heal. And that tendon does not get enough blood supply to lead
Sure.
healing.
Yeah. It relies on that fluid that kind of sits in the interstitial space
Well,
for like
yeah, just having little arteries and veins too.
yeah.
So, and that's the same thing as with a lot of other body parts. Same thing with rotator cuff tears, meniscus tears, ACL tears. All of these things have been presumed to be non-healable and required surgery. So that was what opened me up. Because,
So you're kind of hinting at what you found at work, which is a combination of a powerful natural anti-inflammatory,
Mhm,
and then providing the building blocks for the tendon, which is collagen,
exactly,
right?
exactly.
So tell us a little bit about um, how you even found out about that. And you said that was through your wife. But what set the, you weren't expecting there to be huge results. Were you just kind of taking the medicine so your wife would shut up? Or were you hoping that something would happen here?
Well, I certainly wouldn't word it that way. I get where you're going with this. In no way, shape, or form was this a placebo thing.
Right.
I was thinking, when are the quarantines going to end so I can get my surgery rescheduled? Literally.
Right. Because you're like, man, I need to get this thing fixed.
Well, I mean, I'm left-handed, and it got to the point where I literally couldn't pick up a pen off a tabletop without pain. Like I
Wow.
was getting, it was interrupting my sleep and everything. So uh,
I understand
it was
that.
shocking. It was shocking to me. I mean, I took it every day. I mean, I was home, happy wife, happy life. So and I knew this stuff was healthy. I had a general idea of what they do, but I certainly had never looked into it. I
Sure.
can tell you that your normal MD medical school doesn't teach you anything about any of this stuff. I mean, I limited.
Absolutely. Yeah.
Yeah,
But your wife got into it, and it worked. How long? I'm curious. How long? You started maybe March, April of 2020,
yeah, March, right, mid-March. Yeah,
and how long did it take for you to kind of take a step back and go, wait a minute,
it was right on 6 weeks later. So
six
by
weeks?
late
Yeah.
April, I was like, holy crap, I think this is healed.
Wow.
Yeah. Now I was taking collagen twice a day, turmeric once a day. At the time, it was turmeric. Nowadays, we can go right to curcumin. But yeah, I mean, that was amazing to me, and that's when I started paying it forward to my patients.
Well, it's quite a an introduction into the philosophy and the approach of your practice today, Doc. So let's get into some of your clinical experiences. So tell us about some of these patients where the conventional route of medicine that you were using wasn't working.
Well, you know, uh, within the sports orthopedics realm, it's extremely repetitive. So I was seeing, the average person that saw me typically had either a knee injury, acute injury, or just chronic pain.
Yep,
The most common things I treated would be meniscus tears in the knee, ligament tears like ACL, MCL injuries, things like that. A lot of multi-ligament injuries, like three or four. I used to call them all CL tears, where all the ligaments are torn from a knee dislocation. A lot of rotator cuff tears, other things that can go wrong in shoulders. And
and
again,
those are the rotator cuff. From what I've understood, having talked to my wife's a PA, and she's done so many different rotations in different specialties. But I always get the impression from her that the rotator cuff is like really difficult to repair just with conventional medicine
uh, well, you're talking non-surgically.
or surgically. Even surgically, it can be really.
Well, it's still just a video game. To be honest with you, that's been revolutionized. I mean, we're getting a little off topic, but
Yeah,
the arthroscopic equipment, the tools we have to use nowadays compared to when I was younger and when I began training, it's night and day. So what used to be
sure.
a complex multi-hour case 15 years ago is a 10 to 15-minute thing now. So
With the
we've
current
come a
tools that are
long way.
available.
We've come a
Yeah.
long way with the tools. Yeah.
But still, even faced with the modernization of tools, you found that there were some patients that your conventional approach just wasn't enough.
Well, I mean, no two tears are the same. So when you start talking about massive rotator cuff tears where the whole thing is completely torn and pulled back,
Yeah,
and if it stays there for a long time, it literally will heal in place there, it'll scar in place. When you get to that point, a lot of times you can't even do a direct repair. That used to be a bigger problem, but now we have a solution for that surgically now too, where we can actually bridge that defect with a patch of dermis, believe it or not.
what?
Oh yeah, yeah, and
So help us understand, what do you mean by a patch of dermis?
well, literally dermis.
Yeah, skin.
Yeah, yeah, below the skin, the thick skin, and it comes in a little triangle or not triangle, a square or rectangular patch. And first you get in there with a scope, you clean up the whole area. prepare it for what you're going to do, and then you take that dermis patch at one end, you sew it farther in to where so it's attached to the retracted rotator cuff, and then you attach the other end all the way to the side directly to the humerus bone.
Oh, wow.
Now
So essentially you're pulling that whole structure out.
well, that's ideally you'd love to do that, but in
Right.
my experience, these chronic ones you can't pull them back because they're literally scarred in and healed all the way
Oh, wow.
inside. So what we do is what seems to work now. The name for this is called a superior capsular reconstruction, which is doesn't sound anything like a shoulder rotator cuff. But what it really is it gets back to what's the function of the rotator cuff. The main function of that is to depress the head of the humerus. So when you raise your arm up, the rotator cuff is a nice soft cushion, but thick and strong cushion for the ball of the humerus.
Sure.
When that's torn, now the humerus rises up when you lift your arm up. At some point, it's going to start rubbing the underneath of this bone right here. Right?
Oh,
When I was training, the only answer to that was to get your shoulder replaced, right? Which doesn't do well functionally, right? So this new dermis patch thing was revolutionary to me anyway, because now when you securely attach this patch to the rotator cuff that's retracted as well as the
yep.
bone, it keeps the head down and it gives you that cushion back. Now it comes at a cost of strength. So you're not going to be,
Yeah,
lifting,
it could be bench lifting a bunch of stuff, right?
but it treats the pain, which is at that point, that's all people care about.
Right. They want to be able to have freedom of movement and not experience deep pain at the same time.
They'd like to sleep too.
Yeah. Well, but bridging this gap still, there are some of the approaches weren't enough, and that what were these moments with these patients where conventional medicine wasn't working, and what was that shift to functional medicine? How did it look like in your life and in your practice?
Well, I mentioned two things woke me up. That leads to the second thing. So, um, just to back up, after that 6 weeks of turmeric and collagen cured me, that's when I started getting interested. You know,
Sure.
that's when I recognized that okay, I didn't learn everything in medical school. In fact, I may have missed some really important stuff. And of course, back to my wife, she was championing this the whole time. She's like, "I told you so," and I heard that all the time. Now I'm listening to her. So at that point, I did a quick little research and realized, oh wow, I've got time off. I mean, my practice during that quarantine period, I have an elective practice. I mean, sports injuries, right?
Sure.
So other than being on every once in a while trauma call, I was at home for like 3, 4 months, bored, right? So I took advantage of that time. And we are lucky enough to have a naturopathic school right here in Edmond, Oklahoma. So I started I started taking it. At the time, I didn't really know where it was going. I just wanted to learn. They had a nice structured curriculum.
What's the name? I'm not familiar with the naturopathic school. What's it called?
Energetic Wellness School of Naturopathy. Yeah,
Wow.
right here in Edmond. And luckily because I had already been through medical school, I would Dr. Menzel didn't make me take all of the basic classes, so I was actually able to get there pretty quickly. So within a couple of years, I'd finished that degree. But I mean, it was wonderful learning about the specifics about vitamins, which I can't believe isn't taught in medical school.
Right.
As well as alternatives to all these different diseases. Now, at that time, again, I wasn't treating these kinds of things, right? So I was still doing my sports thing. The difference between the military and civilian practice is profound because in the military, I had endless supplies of young, athletic, mostly males. In fact, we would go years at a time before we saw anybody with a BMI over 30. I mean, so these are all
Yeah.
deep shape athletes.
Yeah, to serve, they had to maintain different kinds of athletic standards, right? So,
Absolutely. So obviously that changed in the civilian world. So when I got to Oklahoma, now I'm dealing with people with chronic diseases and all that. So that's the other reason why I was interested in the naturopathy training. I wanted to come up with a way to try and maximize the chances of getting things to heal after my
Uh,
surgeries, So I still wasn't quite at the point where, well, I take that back. Uh, when I told you I started paying it forward to my patients, that's when this little 6 week challenge that they came up with.
okay, so tell us about that.
Yeah. So basically, I would tell patients my experience, exactly what happened to me, and I would offer them the opportunity to take the same thing. Right. These are all people that had a physical exam, a history, and usually MRI findings confirming something was torn that, just like my bicep tendon, was not supposed to heal without surgery. The majority of these were cartilage tears in the knee, meniscus tears. I probably had about 6 or 7 rotator cuff tears, 2 ACL tears, and several people with just chronic arthritis pain. Uh,
Wow.
and these are people that were looking at any alternative possible to avoid a replacement, right?
Sure.
So we ended up with 31 patients that accepted that challenge. Now, this was over about a 2 to 2.5 year period. You can imagine that not many people were interested in delaying 6 weeks. So
Well, so I mean, this was still was this during the COVID season we're talking about?
it started during that, but I guess it depends on what you mean by COVID season.
Right.
But
Well, I mean, when everything was shut down, a lot of people
yeah,
they couldn't get elective surgeries because there was no place to do them for
yeah,
that was a good chunk of time.
it started right at the tail end of that period and extended
Hmm.
through about maybe mid to late 2022. Well, no, the challenge kept going to 2024 actually. But
Wow.
like I said, most people that have like an acute injury, they're not interested in any delays. Like, I just fix it. I need to get back to work. So it took a bit to accumulate the 31 people. But long story short, I mean, they did the same thing I did. They took collagen twice a day. They took uh, turmeric once a day.
Hmm.
The naturopathy kind of started playing a role because in 2020 timeframe, it was only those two supplements, and I did not talk to them about anything else.
Well, those are the two that you had your own experience with,
Exactly,
right?
same thing for me.
Yep.
By 2023, now I started paying attention to everything else, right? And that's because of
Ah,
the naturopathy thing. So
sure.
that's when I started. I wanted to keep it easy. In the military, we have an acronym: KISS, KISS. Keep it simple, stupid.
Yep.
Plus, I was seeing a lot of folks that couldn't afford to buy a bunch of different supplements and everything. So I stuck with the same two supplements, but I came up with just some simple lifestyle changes and simple dietary changes they can make that are basically, not expensive, if not completely free, and they can just do it. That,
So, did you give a name to this 6 week challenge that you were challenging people with?
I wish I did. No, no, just hey, try what I did.
Sure.
But out of those,
So how would you introduce it? You'd say, "Hey, I know we were talking about surgery and all these other options. What would you say to them to challenge them to try this as an option before they went down that road?"
well, that was easy for me because I've always kind of whenever I meet anybody that with an injury or a chronic problem, the first thing I will do is, after asking them what's been tried already, is suggest, well, here's the non-operative options you have. Then I would go into the surgical options after that.
Yeah.
So for me, it was just the same as what I always did, but then I would add my experience to it.
Sure. It's just like, okay, here are your options,
Mhm.
kind of deal. Well, I think that really opens the palette for us to bring to a close this first part of our interview. And we'll go more deep into your curcumin and collagen success story when we come back next week here in Ultralife Today.
Sure thing.